Many of us experience worrying on a daily basis, but can you imagine having an over-arousal of feelings every single day and you can't remember the last time you didn't feel that way? Anxiety is the second most common mental illness in the world next to substance abuse. I personally have dealt with anxiety for the last few years of my life, and many people underestimate the symptoms of it. There are certain steps you can take to handle anxiety. First of all, you need to be properly assessed, then properly diagnosed, and have the right treatment, if necessary. Every step is crucial, but I will start out with proper assessment. To be assessed, you can go to a doctor or therapist. For me, I personally went to a doctor first, and since the doctor doesn't know exactly how you feel on a day-to-day basis, a therapist can help you realize your symptoms easier with recurring sessions. Without being assessed, anxiety can impair your quality of life. According to Fong and Cillian's article published in 1999, anxiety is defined by DSM-IV as the apprehensive anticipation of future danger accompanied by feelings of dysphoria or symptoms of tension, and it is experienced by most individuals in stressful circumstances. Anxiety disorders take this apprehension to a whole different level. Assessment is the first step in handling your anxiety. The most common mental illness in the world can often be mistreated and misdiagnosed, so it is very important for you to be properly diagnosed. When you are being assessed, you need to be very clear and honest about your symptoms. As stated in Assessment and Diagnosis of DSM-IV by Fong and Cillian, we noted that many men have difficulty revealing the extent to which they suffer from severe anxiety and the level of impairment the symptoms cause. Many people, when assessed, block out factors or deny problems just to feel superior, but it is very important not to leave out your problems in assessment because it can lead to a misdiagnosis. Common symptoms when dealing with anxiety is that your mind will race, you will have increased worrying, a flushed face, your breathing can speed up, and you will feel hot sensations all over your body. When being diagnosed, you may fill out questionnaires to figure out your symptoms and be properly diagnosed. There are a number of questionnaires that can help in the detection of anxiety, including Hospital Anxiety and Depression Scales, Beck Anxiety Inventory, and the Hamilton Anxiety Scale. There are many psychological therapies that can help when being diagnosed. And after you're diagnosed, it is one step closer to being able to deal with your anxiety. The last step to dealing with your anxiety can be treatment, if you feel necessary. There are many different kinds of treatment. As stated by Keaton and Ginsberg in the article Combining and Sequencing Medication and Cognitive Behavioral Therapy for Childhood Anxiety Disorders, which was published in 2008, cognitive behavioral therapy, or CBT, and pharmacotherapy, or PT, are efficacious interventions for over 50% of children and adolescents with social phobia, general anxiety disorder, and separation anxiety. There are specific considerations to guide and help you when dealing with your anxiety. There are also medicinal factors that can be beneficial with anxiety. There are medications like Xanax, Lexapro, and diazepam that are very common and help relieve stress. Although you may not have depression, anxiety and depression are very closely related, so many antidepressants are commonly given out to help with anxiety as well. Although medications aren't for everyone, you need to also consider the potential risks and self-harm that can be commonly interpreted with medications. To better handle your anxiety, there are 3 things that you need to do. You need to have proper assessment, a proper diagnosis, and then treatment if you feel necessary. As somebody who has personally dealt with anxiety, sometimes you don't even need to have a treatment. Sometimes you just need somebody to talk to. So if you or somebody you know deals with anxiety on a day-to-day basis, sometimes all you need to do is lend a helping hand and listen to them when they are feeling overwhelmed.